Hello to the members of the Duval County Medical Society. Thank you for allowing me to have a few minutes to talk to you about a virus that many of us typically don't see in clinical practice, the measles. Fortunately, we have not had any cases in Duval County to this point. With spring break and other large events in the area, thousands of people will be descending on the First Coast, and we are concerned that we may see some measles cases here locally. Since most of us don't see this viral illness too frequently, I thought it would be wise for us to review some of the signs, symptoms, evaluation, and management strategies for the measles. The typical symptoms start with the nonspecific prodrome of any viral illness, including fevers, rhinorrhea, and red, watery eyes. However, approximately 3 to 5 days later, the classic generalized maculopapular rash that starts typically in the hairline and face and spreads through the rest of the body occurs. Koplik spots, those whitish to gray spots on the buccal mucosa inside of the cheek, can also occur, though they are not always present. If a patient presents as described and has risk factors for measles, including unvaccinated status, recent history of international travel, or close contact with someone who has been diagnosed with the measles, your index of suspicion should be significantly raised. Evaluation for measles would include a nasopharyngeal or an oropharyngeal swab within 48 hours or within 72 hours of the onset of the rash. A urine sample for PCR can also be utilized. If IgM blood testing is preferred, this should be done 72 hours or later after the rash onset, as testing for IgM antibodies within the first few days can lead to false positive results in up to 20% of those tested. If a case is strongly suspected, it would be wise to isolate the patient and exclude him or her from school or the workplace for at least 4 days after the onset of the rash. Remember that individuals at highest risk for complications are those who are unvaccinated, severely immune compromised, pregnant women, and the extremes of age, including infants less than 12 months of age. If someone has been exposed to measles and is immune, has received both vaccine doses, then no post-exposure prophylaxis is indicated. However, if the individual is non-immune, then the MMR vaccine within 72 hours of exposure would be wise. IVIG or even intramuscular immune globulin within 6 days for infants less than 12 months of age, pregnant women, and severely immune compromised individuals should be considered. Otherwise, treatment is purely supportive with the use of anti-fever medications, fluids, and treatment of any secondary infections. There are no antiviral treatments that are approved for the use in measles. There is a role for vitamin A, however, and it is recommended for all children with measles regardless of the severity. Oral doses are typically administered once daily for 2 days, and these doses vary depending on age. Please remember that measles is a reportable disease and should be called in to the Florida Department of Health in Duval County at 1-904-253-1850 and press option 1. Also remember that the measles vaccine is highly effective if given in children between the ages of 12 and 15 months, and again between the ages of 4 and 6 years. 2 doses of the vaccine provide a 97% effectiveness rate at preventing measles. Also, please rest assured that the Florida Department of Health here in Duval County is being very proactive and is prepared in case of a local measles outbreak. Please see the attached PowerPoint presentation provided by the Florida Department of Health for more information. Thank you for your time and everything you do to keep our community healthy.